So, in particular, with there being such a shortage today with the Adderall crisis, we're going to talk about an alternative that's starting to become a little bit more popular within even the last couple of years. The one fear, though, with this medication is they don't know a lot of the long term effects from it, but we're going to go and jump right on into it. We're going to be comparing Adderall to Modafinil. Modafinil, first and foremost, is a CNS stimulant. It is, though, however, it's a non amphetamine. However, it can sometimes have the same feeling as something like an Adderall or a Ritalin or even a Vyvanse. But one of the main things in general, though, that it is used to treat currently for is it's not ADD, it is actually narcolepsy. For people who have a lot of problems staying awake during the day, people will sometimes be, or patients will, first they'll see if they have sleep apnea, which a lot of times that can be the case. But also, when other treatments don't work, they'll go ahead and go into modafinil, which is a control 4 medication. Now, one big thing when I mention this, why this can be sometimes a better alternative to something like Adderall. Adderall is a control 2. Now, with Adderall, if we look at that, the bigger shortage right now going on with, it's a controlled 2, as just stated. It is also a stimulant, but it's from the amphetamine class of stimulants. These ones, like once again, Ritalin, Vyvanse, medications like this, they're more commonly prescribed for ADD. Some people, I have seen circumstances as an RN where if you don't react well to Adderall, sometimes they will prescribe something like modafinil, but it's more rare. But now with there being a shortage with Adderall and there being a lot more diagnoses of ADD or ADHD, they're starting to look for alternative treatments. So modafinil is starting to become a more popular one. Now with modafinil, though, as well, kind of going between the two. Modafinil compared to Adderall, they both have a lot of similar side effects. For example, being stimulants, they're still both stimulants. Adderall being an amphetamine, though. Uh, the thing that is pretty common, though, is things such as you got to look out for things such as anxiety, high heart rate, irritability. Sometimes as well, the big thing is insomnia. Now with people being prescribed modafinil more, since there's a shortage with with Adderall in general, one problem that's been arising sometimes with modafinil is when you're prescribed, let's say, 150 milligrams a day, because the average dose is 150 to 200 milligrams. If you can't get your Adderall, and they switch you over, one common problem is that modafinil sometimes lasts a little bit longer. It doesn't hit as quickly, meaning how the medication's supposed to be used, but a lot of times it's causing more insomnia. So you get those effects within the first hour, and they can last anywhere from 4 to 6 hours. And from there, the modafinil going through your system, if it's prescribed for something outside of narcolepsy, insomnia can become a problem, which can lead to other things such as, once again, it can lead to more mental health swings, can lead to more even anxiety, irritability, you name it. Now with this as well, you really have to look at the other side of it as well for comparison to Adderall. Adderall, there's instant release and there's extended release. Right now there's problems getting instant release and extended release, and even Vyvanse. Vyvanse is another medication right now on the market that there's an extreme shortage with. In fact, stimulants in general right now it's just becoming harder and harder and harder to get. Before you know it, probably modafinil will be this way too. But with Adderall, though, I will say it kicks in if you're taking the instant release, at least. It kicks in a lot faster. And typically, once you get used to taking that medication, the benefit of that compared to, for example, extended release is if you're taking it early in the day at least, you typically don't run into problems such as insomnia, near as much anxiety, but although it can still happen, but in particular the insomnia aspect. Same with extended release Adderall, Yeah, it is in your system a little bit longer than instant release. But one thing that's been coming up is with modafinil, if you're not using it for narcolepsy, a lot of times right now, a lot of times the insomnia is one of the biggest problems. Which, let's be honest, if you're not sleeping well, you're going to have all sorts of mental health problems. You're going to be a lot more irritable. It's a stimulant as it is, so with it being a stimulant, if you're not sleeping, you're going to be way more irritable the next day. You can have a lot of mood swings, and that is another thing that can be a problem, is the mood swings. And this can go with any stimulant in general, but in particular with modafinil, if you're not if you get it prescribed for outside, if you have ADD and you can't get your medication and they put you on modafinil, I would talk to your psychiatrist about potentially starting at as low a dose as low a dose as you can to start. You might go, well, I take 40 milligrams of Adderall instant release every day. I know, but hear me out. One day of changing it isn't gonna. You're not gonna be at risk of, any severe side effects. You might be a little tired. But the reason why you start at such a low dose is because sometimes it can be a little bit more effective if you take it at a lower dose. And also, you'll kind of be able to see your threshold if it's causing more insomnia. Now you might go, well, I'm used to taking a stimulant, so my body's prone to, in general, that shouldn't be a problem, the insomnia. But with modafinil, it technically works a little bit different than Adderall in general. As stated, especially if you take instant release. If you take instant release and then you go to modafinil, there's gonna be an extended release effect, and also it takes a lot longer to get out of your system. It stays in your system longer, which can lead to a lot more problems sleeping. Now, some of the benefits, real quick, about modafinil, I will say is and this is for people who take it for narcolepsy and just in general, the people who take it even for ADD, if they can't get their medication, or just in general with side effects, sometimes Adderall, they can be a little bit harsher. So if you can't see when I'm talking about both of them have a lot of similar side effects, but in particular, switching over from an ADD approved medication to modafinil, which is, once again, it's approved for narcolepsy in general, and it's a waking agent, but it is off label right now being prescribed for ADD. There's a lot of similar side effects, but just in general, these are things that you'd want to look out for. But some of the benefits, this is why you'd start at such a low dose of modafinil. I will say, one thing that's been reported is it lasts a little bit longer than like an Adderall, for example, and also sometimes the side effects aren't near as intense as Adderall. Meaning, if you're taking it early in the morning, if you can get the right dose worked out, in particular, you can sometimes avoid some of those things like those extreme mood swings, the anxiety, irritability, and in particular when it comes to the mood swings, I will say the big thing is sometimes with Adderall you take it and once the effect starts wearing off, you kind of go up, then you have that downswing of that feeling where you can be a little bit more irritable, not depressed per se, but irritable, the mood swings, just in general, the anxiety can be a little bit higher, that fogginess kicks in. With modafinil, sometimes that can be minimized a little bit better. Meaning, I'm not saying you won't have that, but with it kicking in and not sometimes being as strong as a traditional amphetamine in general, you can get that perfect dose in to where it's more so just more balanced. You go up a little bit and you balance out and you avoid that dramatic drop or the up and down with it, which sometimes that can be such a problem for people. That a lot of times is what can lead to problems with addiction in general, and why sometimes people will need something for anxiety as well with a stimulant. Another thing you'll want to look out for as well when you're taking modafinil, because a lot of times when people first start, they're like, oh, I don't notice any effect. So they'll start amping that caffeine up. And before you know it, when the medication kicks in and you've had a lot of caffeine with it, you won't be able to judge, is it the medication or is it the caffeine? And you might say, well, I drink caffeine every day, so it has to be the modafinil. Not necessarily. It could be if you just, for example, you drank like a half cup of coffee and then you had your modafinil with it, working perfectly together. Sometimes caffeine and stimulants can have that synergistic effect where they work pretty well together if you can get the dose perfectly. So if you can get that dose right for modafinil, a lot of times you can make it to where you can avoid those mood swings, those ups and downs, and in particular avoid that anxiety and the mood swings. And sometimes in bad in bad situations, if you're abusing the medication, and this goes for Adderall and modafinil, one thing is, and it's in kind of extreme circumstances, if you're taking, you're just taking it, not for this prescribed reason, psychosis, and sometimes SI thoughts, suicidal thoughts. I'll just go ahead and say it. So you have to be very mindful when you're starting a new medication. Now, with Adderall or amphetamines being controlled 2s and modafinil being a control 4 or schedule 4, yes, it has a lower chance of developing an addiction being a schedule 4. But just because of that, everyone's body chemistry is different. You could still develop an addiction to it. Some people who take, for example, Adderall for ADD, they don't have a problem, or they don't have an addiction issue with that. Then they get switched over because they can't get their medication with there being a shortage, or for whatever reason they're changed to modafinil. And then they end up having a problem with that medication because their dose isn't right, and they end up developing a tolerance or even an addiction to it, which can cause a whole new cycle of problems in itself. Now, once again, the reason I'm covering this is because right now ADHD meds that are approved are they're a lot harder to get right now in the market. And a lot of people are looking for alternatives, and I'm just going to be honest. You can watch videos over the counter medications and whatnot. I'm not really someone who promotes a lot of over the counter medications unless I specifically take them myself. I can read over studies and whatnot, but in general, this is what I've found for people to be most effective and what to watch out for just in general. One big thing is if you can't get your medication, they switch you over to modafinil. A lot of times people think, oh, it's a stimulant. It might not be as strong. They take it and they don't expect it, and they have side effects to it, or it works a lot better for them. And their timing of taking it needs to be key, because it really can lead to a lot more problems with insomnia if you don't have narcolepsy compared to, for example, Adderall. It's a stimulant, but it's not something, it can be used for narcolepsy, but in general, it doesn't have near the insomnia effect to it as to something such as modafinil, which is specifically for narcolepsy. Modafinil, once again, can be prescribed for ADHD, off-label though. But in general, the big thing is, as well, as there's just not enough studies yet to show how effective it is for ADD yet. And lastly, how it affects your brain. First off, Adderall obviously affects your dopamine. It increases your dopamine, and even to an aspect, some of your norepinephrine at a faster rate, kicks in faster. Modafinil, it affects dopamine and your norepinephrine, but it's in a more passive way, meaning it's not that instant rush. And that's one main reason why they don't think it's near as addictive, and why it could be something that could be used potentially for people who have addiction issues or coming off of something hard like meth. And that, cold turkeying something like that can be very tough. And a lot of times providers don't want to give something like a controlled to some substance like an amphetamine or Adderall or Vyvanse, which I actually think something like that could potentially be useful for somebody going through methamphetamine use disorder or the withdrawal. Modafinil might be that medication that can help people with severe stimulus use disorder or methamphetamine problems, in the future. But we still need to look at the side effects. Oh, and one last thing. Modafinil in general, headaches, it can increase your headache, just your pain when it comes to if you're prone to headaches a lot of times. I'm not saying it's going to make it worse, but in particular for somebody who doesn't have headaches naturally or whatnot or migraines, it is sometimes common to start to develop some headaches. So be on the lookout for that. And the headaches as well, in general, I know I had a few patients who've taken it in general or switched over or even just take it in general off label. They said the headaches were a lot worse compared to Adderall when they first started it, though. So be on the lookout for that as well. There is a lot of promise with it. I know I went over what it seems like a lot of the negatives are, but I'm just laying out the facts of it right now and why it's being prescribed more. But just if you're taking it, obviously consult with your healthcare provider. I'm not a doctor, I'm just an RN. I haven't done a video like this in a while. I just wanted to throw this out here because it's becoming a lot more common. Check out all my other videos. We're going to be doing a lot more mental health videos in the near future. Medications. We're going to be covering disorders. You name it. This is a mental health channel. I've got my vlog on here as well. Check out the channel. Leave a comment if you've had any problems getting your Adderall, which I've done videos on in the past, or even if you're being prescribed modafinil or how it's affected you in regards to even if it's helped you with narcolepsy or even if you have ADD and you've started taking it. Like, subscribe, comment. I love you all. Have a great rest of the week and a weekend coming up.